Evidence-Based Practice, Picot by Rachel Pierce. The purpose of this presentation is to discuss the issue of hospital-acquired pressure injuries in the ICU. It will discuss what current practice is, what could be done, and if there is some device that may work better than what is currently used to prevent HAPIs. The rationale for choosing this problem is that the intensive care unit has a vulnerable population of patients because they're critically ill, often immobile, and that puts them at an increased risk for skin breakdown. Hospital-acquired pressure injuries should not be as prevalent as they are. Acquiring a pressure injury puts the patient at increased risk for infection, prolonged length of stay, and an increased risk of mortality. According to Kapp and Gertz, pressure injuries affect 13.1% to 45.5% of all patients in the intensive care unit and lead to pain and discomfort for patients, a burden on healthcare providers, and unnecessary cost to the healthcare system. Pressure injuries are a problem in healthcare because it leads to an increased cost for the hospital, unnecessary pain for the patient, and increased risk of complications, among many other things. The research question for this presentation is, in critically ill patients, how does continuous lateral rotation therapy, compared to manual Q2-hour turns, affect the number of hospital-acquired pressure injuries during their hospital stay? The elements of this question are population, are critically ill patients, the intervention is continuous lateral therapy, comparison to manual Q2-hour turns, outcome is the number of pressure injuries, and the time is during their hospital stay. For the literature search, the databases used were EBSCOhost, PubMed, and Google Scholar. The key search terms were critically ill patients, pressure ulcer/sore, Q2 turns, continuous lateral rotation therapy, and pressure ulcer prevention. My search term with EBSCOhost resulted in over 2,000 articles. PubMed resulted with about 35 articles in all, and Google Scholar only resulted with 8 articles. I was surprised to find my articles from EBSCOhost. It had the best results, and the advanced search options helped me sort through to find quantitative and qualitative articles. The 6 articles that I chose were from EBSCOhost. And I chose these articles because they were relevant and they met the criteria of quantitative or qualitative research. They were published within the last 5 years, English language, peer-reviewed, and they met the search terms. The first article that I chose is What are the risk factors for pressure injuries in an intensive care unit? I chose this article because it's a retrospective observational study, qualitative research, and it has ICU patients that developed pressure injuries. It talks about what risk factors they had, such as mechanical ventilation, serum albumin, and among other things. This article was helpful for supporting that critically ill patients develop pressure injuries. The second article I chose is Incidence of and Risk Factors for Self-Load Related and Medical Device Related Pressure Injuries in Critically Ill Patients. I chose this article because it's a prospective observational cohort study. It has quantitative research. This article is relevant to my Picot question because it's about ICU patients and the incidence of pressure injuries and also mechanical device pressure injuries. The third article I chose is Risk Factors Associated with Pressure Injuries in Critically Ill Children with Congenital Heart Disease. This was a non-experimental retrospective study that collected data for 7 years. This article is relevant to my Picot question because it helped provide data on ICU patients, the development of pressure injuries, which is relevant for my population, for the Picot. The fourth article I chose is Critical Care Beds with Continuous Lateral Rotation Therapy to Prevent Ventilator-Associated Pneumonia and Hospital-Acquired Pressure Injuries. This article was a cost-effective meta-analysis with quantitative research. It's relevant to my Picot question because it's one of the few articles that met criteria and also is looking at the continuous lateral rotation therapy to prevent HAPIs. This is helpful for the intervention portion of my Picot. The fifth article that I chose is Clinical and Cost Effectiveness of a System for Turning and Positioning Intensive Care Unit Patients when compared to usual care turning and positioning devices for the prevention of hospital-acquired pressure injuries. This article is a randomized controlled trial with quantitative research. This is relevant to my Picot question because it involves ICU patients, pressure injuries, and compares standard turning and positioning devices to a different system for prevention of HAPIs. This is helpful for the comparison portion of the Picot. The sixth article is Implementation of Pressure Injury Prevention Strategies in Acute Care. This article is observational cohort study with cross-sectional data collection and a retrospective data analysis with qualitative research. This article is relevant to my Picot question because it has a very large sample group of ICU patients, pressure injuries, the location and development of those injuries were also tracked. This is helpful for the population portion. Reflecting on the literature search process, it was very difficult to find articles for the intervention portion of my Picot. I was able to find one good article that met the criteria. It did not provide the research that I needed to answer my Picot question, but did provide enough data to support that the intervention of continuous lateral rotational therapy could be beneficial in preventing pressure injuries when compared to Q2-hour turns. It was very frustrating as well to filter the results of the searches and have only a few articles pop up. It took a lot more time than I initially thought as well to complete this research and to find 6 articles that met all of the criteria. The similarities between articles that I chose are that they all have a common theme of ICU patients developing pressure injuries, and also that ICU patients are at increased risk for pressure injuries. This is important for my Picot question because my population is ICU patients, and the outcome I was looking to compare was pressure injuries. Another similarity is that Edsberg and Pizzini are the 2 qualitative articles that I found, and they're both looking at ICU patients that developed pressure injuries during their hospital stay. Some differences that I noticed are in the article with Shields. They are the only article that uses pediatric ICU patients, which was not a disqualifier per my criteria, but it was the only article that included pediatric patients. Shimura's article looked at the prevalence of device-related pressure injuries, and none of the other articles had mentioned that. And another difference is that Kang's article is the only cost-effective analysis that I chose. The approach that I took to synthesize these 6 articles for my Picot question was the Johns Hopkins Nursing Evidence-Based Practice Individual Evidence Summary tool. This chart made it very easy to organize all of the data from the 6 articles. I especially found it helpful when writing my synthesis for week 5. The challenges I faced during this were that I didn't necessarily recognize the authors' names, so I did have to add an extra column to the chart to kind of customize it. Adding the article title really helped me keep all of my data straight. Based on the findings from the literature, I found that manual Q2-hour turns, the standard practice, may not be effective for patients in the ICU to prevent HAPIs. However, there is not enough evidence to support continuous lateral therapy that's more effective in preventing HAPIs. There's only one article analyzing any of that data. According to Kang and DiStefano, implementation of CLRT specialty beds for mechanically vented patients in the ICUs resulted in potentially significant cost savings when compared with standard care from healthcare sector and societal perspectives. Continuous lateral rotation therapy beds showed a robust cost effectiveness with approximately 93% of PSA stimulations showing dominance over standard care. Cost savings were attributed to a reduction in ventilator-associated pneumonia and pressure injury incidences, also including days in mechanical ventilation and ICU length of stay. Although upfront capital costs create short-term financial burden, the long-term cost savings and improved patient outcomes potentially could justify the investment. The only thing that could be recommended is for more research on this topic to be completed, not necessarily a change in practice. There is room for improvement because 5 out of 6 articles that I chose have shown that ICU patients are at increased risk for skin breakdown from extra pressure on their skin from mechanical devices, putting them at high risk to develop injuries as well. Evidence to support further research. This is supported by Edsberg. Compliance rates for pressure injury prevention strategies were very good for skin assessment and pressure redistribution. Findings indicated room for improvement in prevention, interventions, and repositioning, heel elevation, moisture management, and nutritional support. Kapp and Gertz say, ICU patients are at high risk for developing pressure injuries. Turning and positioning is essential intervention to prevent pressure injuries. However, the effectiveness of turning and positioning devices for pressure injury prevention have not yet been established. These results of our study, in particular those pertaining to enrollment, intervention, adherence, and safety, provide considerations for future trials to seek to investigate how to prevent pressure injuries among ICU patients. Pizzini and Bizzelli state, it is also relevant to undertake preventative measures immediately upon admission to determine patients critically. This is because most critically ill patients are subject to more treatment-related factors and consequential long hospital stays that increase the risk of developing pressure ulcers. Since the recommendation is for more research to be completed, comparing Q2 manual turns with CLRT and what is best for preventing pressure injuries in the ICU. This would require hospitals to likely purchase new beds for their ICU that have the continuous lateral therapy turning device, or to see if their current beds could be adapted to have the CLRT installed. A team would then need to come together to study and publish the results on pressure injury occurrences. The potential issue that may come about with this recommended further research is the cost to upgrade to the CLRT or to upgrade current beds to have that device installed. Kang and DiStefano say, despite these potential benefits, CLRT beds are not widely implemented in ICUs given the upfront capital cost and unclear cost effectiveness. Although several studies have presented a cost savings effect, none demonstrate the value of this therapy in ICU using rigorous economic evaluation methods. In conclusion, hospital-acquired pressure injuries are unfortunately common for ICU patients as they are at increased risk for skin breakdown. There is not enough research to support switching to continuous lateral rotational therapy as standard practice instead of Q2 manual turns to prevent pressure injuries in ICU patients. There is room for research on this topic, and it would be very beneficial to the healthcare community, but a potential barrier to this would be the cost.